Time now to close out hour number one. We'll do this on Wednesdays. Moving forward is Sports Health, presented by Ochsner Andrews Orthopedics and Sports Medicine Institute. Our pleasure to welcome back Dr. Jeremy Burnham. Dr. Burnham, how are you?
Hey, good afternoon. Doing great.
Glad to hear it. I was looking at this online earlier today, and there were some really high-profile ACL injuries in the NFL this past year. Patrick Mahomes probably chief among them, certainly Micah Parsons, Tyreek Hill, local tie with Malik Neighbors, and that would lend you to think another just awful year for ACL injuries, but the data is suggesting that number may be dropping. What have you seen?
Yeah, I think just perception-wise, I'm with you. You see all these high-profile athletes that have ACL tears. It feels like more people are having ACL tears. I'll tell you, my patients come in and, they're talking about it. They're saying, hey, it's because of the new turf at the stadiums and all those types of things. But when you look at the numbers, on average, in the NFL over the last, say, 10 years, about 50 to 60 people on average have torn their ACLs during the season. And in 2025, that number was 30. So it actually was significantly less. We had less ACL tears this year, but it felt differently. I don't know if it's because it was more high-profile people or because we have more coverage, 24/7 coverage than we used to. But it looks like it's actually a down year, which is a good thing.
Anytime, you slice the number, that's less than one a team, which I would, just off the head without any raw numbers at all, just watching the sport over the years, I would think that would almost be impossible. But is your perception that we're making some advances in terms of preventative care?
I think yes and no. We see some things that are happening better from a prevention standpoint. We're doing a lot of research at Ochsner, trying to cut back on ACL tears. Surgical techniques, implants, the things that we use to fix the ACL are getting better. But at the same time, I think if you look at the data just nationwide, the numbers are probably getting higher. There's more sports participation. We look a lot at something called athlete exposure. So not just how many athletes tore their ACL each year, but, how many hours were they exposed to? And the athlete exposure hours are going up. And so maybe the ACL tear rate is staying the same in terms of how many hours that you're practicing and playing. But just because people are out there so much more, there are more ACL tears as a whole.
It's interesting. I just mentioned in the last segment that I don't love conspiracy theories. I'm generally one that will push back on them.
I heard that.
But you sent this over, and I'm kind of looking at it going, I got to get your opinion on it because I certainly don't have one. But there's a story about the 49ers moving to Santa Clara. They're adjacent to this Silicon Valley power plant. Could be potentially some issues that are creating with some health. You give me your thoughts on this situation out in Santa Clara.
Look, Hunt, I think I'm with you. I'm not big into internet conspiracy theories, but gosh, it's kind of compelling when you look at it and do a deep dive. I'm not an expert at these electromagnetic fields, but there's certainly some people making some compelling arguments out there. The part that I found was interesting is that this electromagnetic field can be used to improve tendon healing in short, discrete, exposures. But just like anything else in the body, when you have some level of stress that's going on chronically over a long period of time, that actually leads to a breakdown. And so I thought that part made sense to me in terms of what we know about physiology and training and rest and recovery and all that. I have no idea if there's any validity to this. It's all over the internet. It's probably more just related to circumstance and, coincidence that they've had all these injuries. They're playing a sport that's a lot of wear and tear on the body, but there's a lot of people that are putting focus on the electromagnetic field right now.
The internet doesn't miss anything. I can promise you that. They will pick up on it all. What's new at Elite? We've closed the books on football from everybody but except the NFL, but obviously basketball's in full swing now.
That's right. There's a lot going on at Elite. I was just talking to the team over there in terms of 7-on-7 tournaments and indoor soccer and things like that from a sports participation standpoint. Sports are really happening year-round, so we're available year-round with our walk-in clinic, try to take care of people. One thing that a lot of people don't realize about Ochsner Baton Rouge is that, we actually have 25 orthopedic clinicians now, and that represents all the different subspecialties from foot and ankle to hand, joint replacement, spine, sports medicine. And so we have specialists in all those different areas that, 5 or 6 years ago we didn't have. And so we've really experienced a lot of growth, but we want to make sure we provide comprehensive care, and we can help patients navigate to the right person. So if you don't know who you need to see, we'll help you figure that out when you come in the door.
Awesome. Great resource. Incredible facility over there on Burbank. It is Elite. Dr. Burnham, we appreciate some time. We'll talk in a couple of weeks.
Talk to you soon, Hunt. Thanks.
Dr. Jeremy Burnham with Ochsner. I want to remind you all at Ochsner Andrews Sports Medicine Institute, we know that sports injuries can be unpredictable. One situation you can protect yourself from is safely returning to play after an injury. It's important to seek care by a sports medicine specialist who is an expert in rehabilitation. Their care plan is going to include building back flexibility, balance, endurance, plus psychological support to get athletes back in the game. To learn more about sports injury prevention and treatment, visit oxford.org/BRortho. Appreciate Dr. Burnham. We'll give him some time.